BRONXNET. Your voice, your views, your vision.
And the items on the agenda will be a presentation by the Office of Planning and Sustainability for the New York City DOT on the New York City Plaza program. Then we'll have a presentation from Beth Abraham Health Services and that's going to be an overview of their services. And then we will have a presentation by the Friends of the Hudson River Greenway and the Riverdale River Fest regarding the Fest of 2010. We have an add-on that I can bring to your attention, and that is that we will have a representative from the Census Bureau coming back again to see what we can do to get more people to respond to the census. So without any further ado, I'd like to call Constance Moran, the Bronx Borough Coordinator, and Vadilia Kunjis, the Director of Pedestrian Plaza Program from the Office of Planning and Sustainability, New York City DOT. Good morning.
Good morning, everybody. Nice to see you all.
Nice to see you.
This morning, I have Vidila Kunjis from our Office of Planning and Sustainability, and we've been here before with our Plaza program, but as every year we reinitiate the program, we like to come back and remind everybody about what the Plaza program is all about, and I will leave it in the capable hands of Vidila.
Thank you. So we have this PowerPoint show projected right over into you. I don't want to blind you.
Got one of those again.
Okay. Great. So, like Connie said, we've been here at least last year, but the year before too, and we're just trying to come back every year to refresh, let you know about the program again, or if there have been any changes. So, I'll give you a brief overview first. This program comes from Plan YC. This is the mayor's long-term plan. Has many different initiatives, and one of them is about improving open space. The idea is that we're getting many more residents in New York City. I think they're expecting another 1 million residents. That's like dropping the city of Austin into New York City, and we don't want it to be more congested. So to alleviate some of these issues, we want to create more spaces, more open spaces where we can. For DOT, what that means is that we have to think more creatively about the streets and sidewalks, because that's the space that we oversee. So this program is about looking to find places throughout the entire city where streets may be underutilized or where there is some pieces of roadbed that aren't being used, and converting those for pedestrian uses. Here's an image of sort of a plaza. That's actually a park in the West Village, but it has the look and feel of what we're looking to do, and I think it's helpful just to look at it to see, because it really captures the program in one photo. We're looking for to create social spaces. So here we have benches, people are sitting. There are trees and greening, but a lot of it is hardscape as well, so that people can meet and walk and hang out. This isn't quite a park, but it sort of feels like a park. So the first question may be, where do you put these things? The city is jam-packed with cars, and where can we do this? So I'm going to run through a list of bullets, and in no particular order. First, we're looking to find places where there's excessive road space. There are many streets that come together at strange angles, and they create these small traffic triangles. And in some cases, we can take that slip lane out and bridge the traffic island to the sidewalk. That gives us much more room So we can put trees in that space. We can put benches there. And the ground floor uses can sort of extend and expand into the public realm to create more public life. Here is an example of exactly that in the real world. This is in Dumbo in Brooklyn. And a couple years ago, DOT took away this traffic triangle. It was basically a little parking lot, and delineated it with movable barriers and planters, and put in movable tables and chairs. And even we were able to maintain the parking along the curb there, or at least some of it. This, I guess, to highlight, is a temporary plaza. The program that I'm talking about is a capital program. So all of these projects would go straight into design for full reconstruction. This image, you can't really tell here, but it's actually just paint on the street, which is somewhat different. Here's another example. This is from the first round of the program. This is in Bed-Stuy at the intersection of Fulton and Marcy. And the top image has the yellow dotted line that shows more or less where the future curb line will be. And what we can do is maintain the same amount of traffic for Marcy Avenue, which is where that white car is driving. It creates a shorter crosswalk on Fulton, which you can see in the distance, and it provides much more space for people to enjoy. In addition, we have a public art component. All these projects have about $100,000 that goes to public permanent art. And here you can see the design that is going to take place there. It's a tile mosaic that's done by a woman named Ellen Harvey. Where else are we looking to find sites to do plazas? We need willing and capable partners to collaborate with DOT to maintain them and to program them. And this is very important. Here are a couple of images of people cleaning and painting fountains. And if you don't do that, we get a lot of these, a lot of trash-filled planters like you see on the left here. I'll talk a little bit more about that. We're looking to find places that are very dense, that have lots of people traveling through them. On the top left, you see an image of the hub, which you're very familiar with, which is one of DOT's initiatives. And on the bottom, this is in Chinatown. This is a project that we're going to expand the sidewalks so this market can operate every day of the year in a much larger space. We also want to put them near land uses that are appropriate. So for the most part, that's food. People like to get food and eat it in the plazas. But it can be also businesses that have some waiting element. On the bottom left image, we have a laundromat, we have a hair salon. But in general, the idea is that retail attracts people, and people like to watch people, and these are the types of spaces that we want. So retail is very, very much the land use we want. We don't want, obviously, to place these plazas in industrial neighborhoods. And finally, but still very important, is that we want to find places throughout the city that lack open space and to put the plazas there. This map is a little bit difficult to read because of the color, but essentially red means that it lacks open space. Yellow is low or moderate income, and orange is where the lower moderate income and lack of open space overlap. So we're looking ideally for community boards here in the Bronx. You can see it's CB11, CB9, 10, and 12. Those would really be our target community boards. So if any of you know of nonprofits or interested organizations or sites, feel free to, we urge you to spread the news. So let me go through briefly what the different partners' roles and responsibilities are. The nonprofits that are selected to work with DOT would be involved throughout the entire process. They would work with local landlords and property owners and elected officials and the community board to make sure everybody knows that this project is moving forward. They would be at the table for design. We would take their advice to heart because they would ultimately be maintaining the site. So we want to make sure to build a plaza that is maintainable. They would ultimately take on all of the maintenance for the plazas. Here I have a list of many things: sweeping, cleaning, putting away the trash, getting rid of the snow and ice, pest control, etc. Essentially, they would be sort of the local owners. They're basically kind of like renting the space from the city. They would have to have insurance and indemnify the city. The idea is that if they're the responsible partner and they should be sweeping the streets and they fail to do that and somebody slips and falls on the leaves, that they, by not fulfilling their responsibility, they need to protect themselves against damages that may occur as a result of their negligence. And that's just standard procedure for city contracts. Programming events, I'll mention a little bit about that, and we'd like to see a long-term funding plan. The upside of this is that we have a new model that allows our partners to generate revenue from these sites. So we have three mechanisms. One is the partner can have a sub-concession. This could be food or flowers or something, but they would put out an RFP and they could attract a business, which would help to pay for some of the expenses. And they would also be able to get some revenue from sponsorships and commercial events, and I'll mention that in the next couple slides, right after this one. The city's role and responsibility is to fund all of the design and construction. In our first round, the plazas came to about $2.5 million each, so that's all taken care of by the city. The permanent art, likewise, is happening through the Department of Cultural Affairs, and construction will actually go through Department of Design and Construction, but this is all taken care of in the city. So here are a couple of programming items that we'd like to see in plazas. One is temporary art, in addition to the permanent art, and we have a temporary art program which the partners could apply for. You could learn about that on our website. Markets, we'd like to see active food markets to promote healthy eating. They could be holiday fairs and craft fairs, things like that. Public events. These could be non-commercial events to sort of highlight the public life and to get people outside. They could be physical activities like this, or something like putting out a movie screen and watching a sporting event. I mentioned the new model that allows nonprofits to generate revenue from the sites. Here's an image of a movable food cart. This could be part of a sub-concession. It both brings activity to the plaza and it generates revenue for the partner. It could be a permanent kiosk like this flower stand. Sponsorships allow the partners to avoid some of their costs by having, in this case, Google pay for planters in one of our plazas. And through event concession fees, and in some locations where we have high-profile sites and businesses want to have a presence, they can have a commercial event. And when they bring that event to the city, they have to pay a fee to the city, and they also pay a fee to our partners. So that's one of the three mechanisms for helping them to offset their costs. So then just a couple more slides here very briefly. This is the application. This is only for nonprofit organizations, and this is our criteria for rating which projects we move forward and which partners we go with, and all the details are outlined in the guidelines. Essentially, we're looking to put these where we have open space. I've talked about that already, where the group has taken some initiative to move a project forward, so they may have plans or designs or even some discretionary funds from a council member. The site context should be appropriate. We talked about this already. Surrounding land uses, retail, transit, access to transit. Capacity, we're looking for organizations that have some ability to take something like this on, so at a minimum they would have a paid staff. And then we give some points to organizations that are located in communities that are low or moderate income. So where do we stand today? Here is a map with dots throughout the city that show where the city's invested funds for public space projects. These aren't all just the New York City Plaza program. These are other projects as well. But you get an idea that most of our money is in sort of closer to the Manhattan Central Business District. So we're trying to look for other areas outside of the city. Timeline. For anybody who applies to this program, the deadline is June 30th, and we would essentially select partners and begin design about a year from now. That would take a year, and then construction would begin. And that's all. Here is our contact information. You can show people our website if they want to learn more information, or just to contact us directly, or you can work with Connie and her staff to talk about the program. Thank you.
Thank you for the presentation. Can somebody put something in front of that light?
I got it off.
No, it's the light.
Oh,
It's
the
the
light's
light.
still- oh.
It's the light. That's it. Right. Thank you. Yes. Yes.
Thank you, Deputy. My question revolves the insurance and the fact that a lot of not-for-profits in poor communities are not going to be able to withstand the insurance costs. And has the city given any consideration to finding some way to ease that or to sort of intervene in that process?
No, it's a good question, and I think a very legitimate question. Most of the organizations that have applied are stronger, bigger organizations. So business improvement districts that have been around for a long time, it's not a problem for them. And a lot of nonprofits carry insurance already. So the added cost to expanding their policy isn't necessarily a deal breaker. If it's a fledgling nonprofit and they're just getting going, it could be an option. And in that case, it may require them to wait for a while. We're looking at ways to try to make the burden less to these nonprofits, and that's why this model was developed that allows them to generate revenue to help pay for some of these costs.
Okay, I just think it's worrisome that a not-for-profit assumes they're going to take on that kind of liability, and that there would be a reluctance on their part to do that. And that, I think that probably one of the reasons why we didn't see any examples of Bronx or other communities, but we saw Manhattan exclusively for the most part, and we didn't see any of these programs highlighted in some of the boroughs or somebody other than Brooklyn, some of the outer boroughs. And I think that might be one of the reasons, because I know in our community there are some spaces, but it'd be very difficult for us to get people to take on that, or in addition to taking on the responsibility of maintaining a public street. It's still a public street, and so we take on the cleaning and the maintenance and all the other responsibilities. I think presents a real challenge for a lot of convincing a not-for-profit to take on all of those responsibilities.
Yeah.
So.
No, that's a good point, and it's true. It's a lift. There are Bronx organizations that have applied. We've awarded Sobro in our first round. They're more of an established organization, but it is a concern, and that's why we have this model that allows them to generate revenue, so that when they do have added costs, they can help to pay for those. Connie, do you want to add?
If there is a group that's interested, and what I have found in talking to some of the nonprofits when they were applying, is that if they can get another partner to help them out. A lot of the nonprofits in the Bronx can partner with a larger concern, such as, I'm just going to throw out a name, Montefiore Hospital. Montefiore is a large company in a way. They're a healthcare facility, but they obviously could be a partner with another smaller nonprofit to, be the manager, to help them get going with it. And as Fadila said, the change in the model from when we originally did it was the component now that they can produce revenue. So, if they have one of the examples shown was a market or a food cart that if they got that party to come in with them and, said to the food cart person, I mean, it would all be, they would work this out. But there is ways to, to do things that would, maybe cover the cost of their, their insurance costs or their, the maintenance costs.
That's a good point, right?
What we usually find is that, in a smaller plaza area, something that's, as big as this room, let's say, if they had one party that would be the sweeper and one party that would clear the snow. But I think a lot of times that if they, can partner with a larger person, that would help them as well. But if you have any groups that would like to discuss it, there may be a way to partner people together.
Great.
So we could, you can work through my office and I'll work with Vidilla. And a lot of the, we are lucky now to have some more bids in the Bronx than we had before. We have the 3rd Avenue bid, we have the White Plains Road bid. I know that there's other bids that are kind of being worked on now. So, actually the bid does have insurance. So if it was the, a group partnering with a bid, that would also be a way to go along.
Okay. Thank you. Thank you, Deputy.
Okay. Arlene?
Good morning. I have a quick question for you, Commissioner. In the slide that you showed us on the page 5, it showed the top portion where it had approximately 11 cars parked, and then on the lower portion, there are about 4 or 5 cars parked. I'm curious as to how these spaces have impacted the parking, especially in the more congested neighborhoods.
Mm-hmm.
Can you show me the slide?
Yeah. There you go.
I don't wish to blind.
Oh,
No, it's not, it's all right. I think, are you talking about the triangular area in Dumbo?
Yes, in
Correct.
Brooklyn.
Correct. How does it impact the parking?
we got it
Our
here.
Well,
areas. Parking is
if
very
you-
key.
At that location, it was a triangular area that had approximately 12 spaces, maybe. And when they built the temporary plaza, they regained about 5, so you lost a total loss of 7 spaces. My counterpart in Brooklyn didn't have any problem with those 7 spaces being lost. They worked with the community wanted the pedestrian space. The greatest example of this taking parking and making pedestrian spaces right down the street here. I don't know how many people, I think Lou Gehrig Plaza is probably one of the most beautiful plazas we have, and we lost, maybe 40 spaces. And the community, I think, benefits from having Lou Gehrig Plaza than having 40 cars parked in the middle of the road. So,
And
we don't do it haphazardly. We work with the community and the community board, so that would be part of the process.
And I'll just add that because this is a community-based program, that we're looking for community groups that come to us who want to create public space. If their priority is maintaining parking over the public space, that's fine. There are other communities that would prioritize public space, and those would be the projects we would move forward. So DOT is not forcing communities to do this, but selecting those that want to do it.
Okay. Any other questions? Yes. Jeff?
Thank you, Madam Deputy. 2 quick questions. One is, has the NYPD or Department of Homeless Services taken a position on this? Has the NYPD or Department of Homeless Services taken a position on this? Because obviously this is going to create a situation where we may have encampments, or it just may, there may be a larger congregation of people, and, we're hearing police shortages in all our precincts. I know at the 43rd precinct, that's a major issue that the community board puts as a top priority. And while we greatly, and I know the council member really feels strongly about having a plaza program in, New York City, it's just going to create the added need for maybe additional enforcement, additional outreach from, homeless providers and homeless services. So I want to know has there been any dialogue between the agencies on this program?
Yeah, this dialogue with PD and with the people that you're talking about, homeless services, I can tell you many of the temporary plazas that have been created have not found the problem that you're talking about.
Yeah, and I'll add that, we can speculate a lot of what will happen, but we're trying to create spaces where there are lots of people looking at and interested in this space. And from our experience, it's spaces that aren't being used that people tend to inhabit. The health department is very much in support because they're trying to provide more spaces for active living and to reduce obesity and diabetes. So this dovetails with their programs, and so I don't think that problem necessarily will exist.
Yes, I would see a shelter run by a nonprofit or even the city volunteering to maintain the space. I think a Samaritan Village in Highbridge, which regularly creates volunteers amongst their residents, and they take care of Highbridge Park. I would see that as a plus, having a homeless shelter run by a nonprofit to perhaps maintain such a site. Do we have such examples?
Not yet. Ultimately, DOT needs to sign an agreement with some organization. So that could be a nonprofit that works in providing homeless services, but we would have an agreement with that nonprofit. And if they wanted to, work with their constituents to do the work or to do programming, that would be fine. But ultimately, we need a nonprofit partner to sort of sign on the dotted line.
Thank you.
Did you want to say something? Wilhelm Ronda from our office.
President's office. Just a couple of comments on this. I think the Diversity Plaza program is probably one of the finest programs to come out of the Department of Transportation in a very long time. We're beginning to look at our streets, particularly in places like the Bronx here, where we saw so many challenges over the last 30 years. Our streets are now beginning to look at our neighborhoods and our streets to see what further amenities we could bring to our neighbors. We built out the lots and the blocks, and now we're looking at the public spaces, and rather than just having public spaces that are there, looking at them as a way to help beautify a neighborhood. This whole concept dates back like over 100 years with the City Beautiful movement, where city fathers and philanthropists were looking for ways to improve the quality of life of people right in their immediate neighborhoods. So this is an amazing program here, and the Borough President's Office has been a partner with DOT in trying to advance this project. So I certainly want to congratulate the department on it. There's just 2 points that are kind of some growing pains that we have to face, and that is the issue of the insurance and the capital improvements. The bids downtown, they're much better heeled than we are in terms of Bryant Park and Times Square and Herald Square areas than we are up here in the borough of the Bronx. Our bids found this a challenge, and I realize it's part of the growing pains that we have to go through. But I just have to red flag those 2 things, because those are real financial challenges even for a bid in Bronx County is quite a challenge. It's something that's been dealt with on Fordham Road and continues to be dealt with on Fordham Road, and will be dealt with shortly in the hub. So certainly that shouldn't preclude us from moving forward, because this is an amazing opportunity to help beautify our neighborhoods. But at the same time, I have to just red flag those 2 issues, that the insurance over somebody tripping and falling. It's one of the cash cows of the legal industry in the city of New York, never mind Bronx County, that somebody trips and falls, forget it right away. There's a suit that happens. And also the issue of the capital maintenance. Those are financially heavy lifts for even a Bronx state to carry, certainly on their own. So maybe that part of that growing pain is to try to look at how we can mitigate the impact of that on bids, because the bids in Manhattan certainly have much more capacity than we do up here to carry that burden on our own. Thank you very much.
Wilhelm, I don't know if you were in the room when Gregory asked the same question. What I said was that we have changed the Plaza program slightly, that we will now allow these partners to have concessions that can create revenue, which would help them with the cost that you're talking about. I also suggested there are a lot of large corporations here in the Bronx who could be willing umbrella partners with them, such as, and I threw out the name Montefiore Hospital only because it's one of the largest in the world. They could partner. We look to try to make it work. So if there's, as I said to Gregory when he asked the question, if there's groups that are interested, we'd like to have a dialogue with them so we can try to help them along and move the process along so we can have more plazas. And you spoke about the hub, and and Sobro has committed to us to be the maintainers of the Roberto Clemente Plaza when it is built. So, you know, we through negotiations, we can try to find help for everybody. So if you have specifics, we'd love to work with them.
And just to add, one point is that we want this program to be successful, and I think you're exactly right, that to be successful, there can't be new added costs to these nonprofits. So we're looking for creative ways to do that. And the new model that allows groups to generate revenue from sub-concessions, limited sponsorships, and through commercial events is one avenue, but we're looking for other ways to do that. And this is a brand new program. We launched it 2 years ago, so it's still going to develop and change. And if you have other input and suggestions, we would take that.
Okay. Yes.
Hello, good morning. My name is Z. Tirado, and I have a question with respect to insurance. What is the average coverage that is required for a plaza for a partner? Because there are issues of vicarious liability for acts of criminality or civil acts against an individual. So I'd like to know what is the cap that you're looking at for insurance coverage?
Yeah. I'm not a lawyer, so what I can say is that we can get the information for you, but essentially what it requests is that, or outlines is that the partner of the city is responsible for negligence and damages that may occur as a result of their negligence. So the coverage looks to that. We can give you a copy of a signed agreement that we have. It would probably be different from these permanent plazas because the agreements that we've signed so far are for temporary plazas. And in some ways, these temporary plazas have more expenses and are kind of different animals because we still have curbs there. And so they will change, but we can give you that agreement if you'd like to look at it.
And an additional question, when you have street fairs or whatever kind of fairs that you may have, if you know the answer, would you require additional insurance on top of that?
Yeah, whenever there's an event or a fair, whoever holds that or asks to get the permit for that is required to provide additional insurance.
It wouldn't be the bid itself. If the bid, or let's say the nonprofit group said, you know, they wanted to have an event with a certain person, that person would have to hold their own insurance, just as they would if they were doing a street fair any place in the city.
Thank you.
So it's the manager of the event, not necessarily the place that the partner that's managing.
Thank you very much.
Okay. Well, I want to thank you for the presentation this morning.
Thank
It
you.
was quite interesting. Thank you.
All right, there you go. No problem. Here we go.
Okay.
Yep. You just need to move that little thing.
Thank you. Oh, no.
Blindness.
But they're not next.
They're not next.
They're not next to Abraham.
Yeah. In fact, if you can just turn the light off on that
Yeah.
thing, it would be so good. Yeah, I think you dimmed it. Okay. Thank you. Got spots in front of my eyes. Okay. I want to thank the DOT for that presentation. It was excellent. Our next presenter is Jackie Kennedy, the Corporate Director of Government and Community Affairs, and Florence McCharles, the Vice President of Home Care Services for Beth Abraham Health Services. It's a little tight up there.
Enjoy the weekend, everybody.
You too. I want to thank you for being with us and responding in a very short time.
Good. Good morning, everyone.
Good morning.
As was mentioned, my name is Jackie Kennedy Sadler, and I am the Community Relations Manager for the Beth Abraham Family of Health Services. Actually, that was my old title. I just got promoted, excuse me. I'm the Director of Government Affairs and Public Affairs for the Beth Abraham Family of Health Services. Today, it was mentioned I'm here with Miss Florence Monk-Charles, who is the Vice President of Home Care. I wanted to thank the Deputy Borough President and her staff for inviting us here to talk about our services. I bring you greetings on behalf of our President, Mr. Michael Fassler. The Beth Abraham Family of Health Services is a multifaceted, nonprofit healthcare organization. This year, we will be celebrating our 90th anniversary of providing services in Brooklyn, actually in the Bronx, excuse me. As the New York State's second largest continuing care network, we are an engine which provides services to over 7,000 individually in the metropolitan area and Westchester County. Our commitment to the community is to provide compassionate, high-quality, person-centered care to our residents. Our services include our skilled nursing facility, in which we have implemented a model called the person-centered care, which basically promotes independence and individuality. We have a state-of-the-art rehab department, which basically, when compared to the state and national average, we have superseded both. We have 7 adult day healthcare programs in all the boroughs. We have the Music Institute. We have independent housing. We have a comprehensive managed care program, also a licensed agency, and our long-term home care program /HIV, which I will turn over to Ms. Florence Monk-Charles to give you an overview.
Good morning, everyone.
Good morning. Can you pull your chair over closer to the mic?
Just give me a second to get our...
Oh, they're going to use it. Okay.
Ready? Okay, and I'm on desktop.
Desktop, so minimize it. Close that.
Should be on desktop.
Click right here. We'll see it.
Yeah.
Can you see yourself there? There you go. You want to go to slide?
Yes.
View? Hit view. And then slideshow. There you go.
Good morning again. I'm delighted to be here with you to share with you some information regarding our long-term home health care program. Our focus today will not only be on the long-term home health care program, but also on long-term home health care program, our HIV/AIDS program. This is a program that started in 1977 in the New York State only, and it provides skilled nursing care to people who would otherwise be in the nursing home. We not only provide care to senior citizens, but we also provide care to the younger population who have a chronic long-term care illness. Our clients receive personalized care in the comfort of their own home. And this program is jointly administered by HRA, which is the Human Resources Administration, and the provider agency, which is Center of Nursing and Rehab, part of Beth Abraham Healthcare System. And our program is also it's a capitated program whereas the total health care of the individual is the total health care need of the client must meet must not exceed a certain amount of money on a monthly basis. And this is a cap that is allocated to each provider on a yearly basis. Just a little history about the program, created in 1977 by Senator Torquay Lombardi, and it was created to address the need of the frail elderly and chronically ill patients. And in the late 1990s, since there was an epidemic with HIV/AIDS, this program also included patients affected and infected with HIV. By using the patient's own home, the legislation was aimed to decrease the waiting list of patients who were waiting to be admitted in a nursing home, decrease the number of patients entering facilities, because we do know that most people want to remain at home instead of being in a nursing home. And also it was aimed at decreasing the cost of care, because with a capitated program, we wanted to make sure that the total health care cost did not exceed a certain amount. What's the goal of the program? Is it provides care in the comfort of the client's home. It increased medical compliance. We want to make sure that every patient who's receiving services from our program, they continue to see their doctor, they go for their medical appointment, and they follow up with the medication regimen that has been prescribed for them. Our patients do not have to be homebound, so they can go to day center, and we encourage people to have a social life. They are not in a nursing home. Therefore, their quality of life is definitely improved. And one of our major goals is to prevent rehospitalization and frequent visit to the emergency room. We do know that the high cost of emergent care. I can share with you a story that when a client goes to the emergency room, it costs Medicaid around between $5,000 to $7,000 for that one visit in the emergency room, because there is an array of tests that must be taken, plus the cost of emergency room is excessively high. So for patients who have a long-term illness, it's important that we provide care to them on an ongoing basis and prevent them from being rehospitalized and going to the nursing home. The criteria is that those patients that we service must have Medicaid or be eligible for Medicaid, and they could have Medicare. And we provide care to patients with HIV. If they don't have Medicaid, ADAP will cover the cost of their services. No. I talked about the cost of the care. And on a yearly basis, we are mandated to provide care to patients at the cost of 75% of what it would cost to keep that patient in a nursing home. And on a monthly basis, we must compute that cost and submit this information to HRA, which is our oversight agency. Every 4 months, patients are visited by HRA and the nurse in the long-term home health care program to review the plan of care and ensure that the total cost of care does not exceed 75%, and the type of services that are needed by the patients are provided by the provider agency, which is Betty Braham long-term home health care program. Our patients affected with HIV, they do not have a cost cap. However, we monitor the expenditure on a monthly basis and ensure that only services that are needed are provided. Beth Abraham long-term care program has one of the largest HIV/AIDS program in the New York area. We have our team of skilled nurses, therapists, nutritionists, social workers, and paraprofessional staff who provide care to patients in their own home. And I shared with you before that if, in the case of an HIV patient, if they do not have Medicaid, ADAP will cover the cost of care. In our program, patients who are 21 years old and older can be admitted. They must have a diagnosis of HIV. They must have Medicaid. And we provide care in all 4 boroughs of New York City, except Staten Island. We provide in-home preventive diagnosis and supportive services. Patient must have a physician in the community that, in order to ensure the care is well coordinated. And the physician must determine that the patient psychosocial need as well as medical need can be met in the community. For patients with HIV and who are extremely sick, we can provide up to 24 hours of personal care if that's what's needed. Patients who are already enrolled in another managed care program cannot participate in the long-term home health care program. For example, if they are enrolled in mental health plan, managed long-term care program, and a PACE program, they do not qualify. They will have to disenroll in those programs in order to participate in the long-term care program. This is important because at times people have enrolled in another program that prevent them from receiving services in this program that may meet their needs. And we assist them with the disenrollment process if that's where the patient's care could be best met. These are the services that we provide: skilled nursing, rehab, social work, personal care, IV therapy in the home if that's what's needed. We have nutritionists who make home visit and provide nutrition counseling. For patients with HIV/AIDS, their nutritional intake is quite important, so most of these patients do receive nutrition counseling. Substance abuse, we do have patients who are former IV drug users, so we provide substance abuse counseling. Telehealth monitoring, as we do know that many patients have chronic long-term care problems, and with the advance of telehealth, we can monitor them on an ongoing basis and prevent them from being re-hospitalized by identifying at an early stage signs and symptoms of decompensation, and in return help them seek medical supervision so that they don't have to be hospitalized. We provide pastoral care for patients who are dying, and so that is one of the services that we are mandated to provide. And we connect with different religions and provide that service in the home. And other waivered services such as social daycare, home improvement, moving assistance, medical daycare. I just wanted to share with you some information regarding the seniors who are affected in the Bronx region by HIV/AIDS. We do have a large number of seniors who are infected with HIV. Many people in the district, Morrisena, Crotana community building in the District 3, we have 647. Highbridge, 619. Morris Heights, 540. In total, we have identified there's over close to 7,000 patients who are within those communities in the Bronx, who are over 50, who are infected with HIV. The Bronx has the highest number of seniors who are infected with HIV. So it is important that everyone is aware of that and know that they can seek help. We do have a very comprehensive program that can help them out, and we are more than happy to provide those services and help to prevent the spread of HIV. So as a member of the community, Beth Abraham wants to ensure that we do a lot of prevention. And that's one of the reasons why we are very happy to be here and share the information with you. And also, if you do have, people in the community who might benefit from those services, please feel free to refer them to us. Any questions?
Yes, I have a question. With respect to the disenrollment, sometimes people are concerned that there's going to be a gap of non-coverage. Do you work with them so that they're not left in the lurch empty? How does that work out?
When a client is identified as being part of another managed care program and in needs of to be disenrolled, we do have a social work assistant who will help them with the disenrollment from the managed care, and in return, when the managed care disenroll them, we will start services without gap. So we do take care of that. That is a very important priority.
Thank you.
Any other questions?
Any other questions, Arlene?
Thank you, Madam Deputy. It was a wonderful presentation, very timely, and I can see that we have an urgent need for this in our area. How does patients get enrolled in your program? How do they get referred to the program?
They could call themselves. If a referral can be made by anyone, and is kept confidential. And we will go to the home, do an assessment, assist the client, the potential client, to complete the necessary forms. If they need to be disenrolled, a social work assistant will assist them in the disenrollment process and ensure that services are initiated right upon disenrollment.
Also wanted to add, for the nursing home, if the person were to have a stroke and go to the hospital, then the social worker would contact us through a PRI, which is a patient information, and then we'll make the assessment from there as well. In addition to that, we can get referral from the district managers. We can get referral from churches, from basically everyone, can refer to us. Mm-hmm. And just to add to the HIV program, it really breaks my heart to see that seniors are rising with HIV. When we get patients that 85 years and older and just, become diagnosed, that pains my heart. At 85, you should be going to a senior center, doing, some other stuff, not being worried about HIV. And so as a result of that, we have started a senior task force to address that. And we will be meeting once a month to talk about these issues, not only HIV, but other senior issues. And so we invite you, if you know of a senior that are isolated and, just need to get out of the house, please give us a call, because that's one of the things that we do. And to add to that, we're going to have a leadership breakfast conference on October 28th, focusing on HIV in the older 50, in the 50 population. 50 and older. Couldn't come out.
Jeff? Can somebody put a block?
I know one of the difficulties that our constituent liaisons have is when someone really needs long-term care or nursing care, but there's a stigmatism out there in communities that if someone goes there, you're basically cursing their family's name by doing that. So How is it that we bridge those gaps and, you know, get over those hurdles? Because I know when our community liaisons recommend institutions like this, the children of the parents like, no. I'd be, you know, kicked out of the family if I did that.
I thank you so much for bringing that up. In our facility, as I mentioned before, we have the person-centered model, meaning in terms of the organizational chart, we have the old way. The administrators were on the top and the patient on the bottom. At our facility, we flipped that chart. We have the registrant or the patient on the top and the administrators on the bottom. That means they have a more stronger say in terms of the care that they get. In terms of family perception about nursing home, I will share this story with you. At our facility, we have this senior who came in. I believe she had a stroke. And her daughter said that she wanted her, to come back home, on the weekends, because we do give the weekend pass. If you're in the facility, you can go back home on the weekend, and come back to the facility. Sure enough, the daughter took the patient home. The home that the patient got married in, raised the children, just so familiar with. When they got home, the patient said to the daughter, "I want to go back home." She could not understand what is this patient? What is my mom talking about? This is home. She kept on saying. So she said, let me just think about it and see what is she saying. She wants to go back home to the nursing home because that is the home that she's used to, because it has the interdisciplinary team of staff to really address her need. In terms of the care that we provide is high quality. It's home away from home. So in terms of the myth about some nursing home, I know that there are some problems in other facilities, but at the Beth Abraham Family of Health Services, we are CARF accredited, meaning that is the highest standard, for any kind of facility like that. And we make sure that the patient get the best quality care.
And what about the fact that, in some cultures, it's more like a sin to put your parents in a home and...
Well, that's what we try to do. We try to demystify all those things, because in certain cultures, you're right. If you put a person in a nursing home, it's like you're putting them there to die. The kind of activities that we provide for the patient, they are so excited. They feel like it's good. And it's most of the time is the caregiver that is feeling like that and not the patient. And once you bring them to the facility, they see the care that they're getting, all of that will be changed. You want to add anything to that?
In the home care setting, we do have staff who are who ensure that they do not share information regarding the patient's diagnosis, and this is a law, a HIPAA law as well. So when a nurse or a professional therapist or a nutritionist visit the patient's home, they are bound by professional mandate not to share information about the patient and their diagnosis. So the neighbors and the other people in the community would not know if a senior has HIV, and that's the reason why you're getting home care. It is transparent. We do not, we ensure that confidentiality is kept, and which is key because it's important for that patient to feel safe that whatever information that the professional coming into the home has, it's not shared by that professional with someone in the community.
Yes.
Thank you, Madam Deputy. Question. Since there's such a prevalent rise of HIV/AIDS in the senior community, and I'm not sure whether you addressed this or not, have you had the opportunity to go to local senior centers to give these presentations? Or is this something that you would like to have an outreach with the community board members to have health fairs, et cetera?
Actually, it takes a village to raise a child. It takes a village to maintain the senior. We do work with the community boards. We work with the churches. And we are here today to just, seek your help, because we need partnership in this. We can't do this by ourselves. You know, and the only thing that we can do is to provide the education, and you will be able to help us by putting it in the newsletters, have us come to your board meeting to talk about this issue, and, you know, just try to see whatever outreach that we can do to just make sure that we diminish, you know, this devastated disease.
And remove the stigma as well.
Yeah,
Yes.
sure.
Because, the senior who has been diagnosed with HIV, and because of the stigma of the disease, they feel horrible, and they don't want to. They do not know where to go, and they don't want to share this information with people who might put them on the side. So it is a big dilemma for them, and they do need a lot of support. So you know, helping them to find ways of getting that kind of support and get the advice is very important. So we reach out to you to see if, you know, we can provide information. Information is power. So they will know how to reach out and get the help that they need. And also, psychologically, they are devastated. And, you know, and many of them may be depressed because of that. So we have social workers who can help out with that as well and provide counsel, even if they are not in the program, because, you know, they become isolated, depressed, and upset, and may not know where to turn. So by providing the information and letting them know that there are organizations out there they can reach out to, and in confidence ask questions, clarify issues, and seek help, you know, and be directed toward places where they can get the best care. You know, they do have the choice.
Cleveland.
Good afternoon.
Good afternoon.
Cleveland Beckett, Councilmember Seabrook's office. Two quick questions. Number one, you spoke briefly about the disenrollment process, but I'm just curious on what's like an average time frame in terms of how long that process is entailed. And then secondly, I commend you on your presentation, and I was curious if there might be opportunities, obviously if we make arrangements appropriately, to have like a structured visit to kind of see during the hours in which you're operating. Because while you tell a great depiction, I'm sure it's probably even better in person. And I know I would probably be interested in getting an opportunity to view the setting.
I thank you for the feedback. And as far as the disenrollment process, it takes about 6 weeks to disenroll, particularly if you meet the client at a certain time of the month. The clients are only disenrolled at the beginning of every month, at the first of the month. So if you have someone who's and you assess their need for long-term care, and it occurs like the 15th of the month, you're going to have to wait.
What's your vacancy rate for the long-term care facility, the nursing home?
What could you repeat? That?
Vacancy. Do you
The
have
vacancy?
Yeah.
Well, as it stands right now, we are not at capacity. We're seeking patient. Times, you know, it for some reason seems as though people are not going to the hospital. Well, what am I saying? It seems as though that the stroke rate has decreased in certain areas and other illnesses and stuff. So they're not going to the hospital, so we're not getting as much patient. Another thing, there are so many, the Bronx is overbedded, meaning that there are several nursing homes in the Bronx. And so we have to be just out there at, someone mentioned earlier about Montefiore Hospital is one of the largest hospitals in the Bronx. We have to be at the various hospitals just working with the social workers and just basically marketing. Sure.
Okay. It's good to
That's
know.
for the nursing home component. But with the long-term piece, basically.
We are allocated by the state a certain number of slots that we place nursing home beds. And currently we do have about 200 availability in the Bronx. So
Okay.
we could take many patients.
Let me just also add to, in terms of the facility, we have 4 facilities. We have one in Westchester in terms of the nursing home, one in Westchester, the 612 Allington Avenue. Then we have one in Brooklyn, which is a Center for Nursing and Rehabilitation, and then the Margaretes in Queens. Mm-hmm.
Okay.
Right. So we're comprehensive. You know, we're a one-stop shop. We have the nursing home, we have the long-term care, we have the adult daycare program, we have the licensed agency. So if someone is looking for a job, we are able to provide, you know, a job for them. We also do the training.
Free training.
Yep.
So if you have any of your constituents who might be interested in becoming a home health aide or a personal care worker, we do
Right.
training once a month.
Right.
And in our facility, in addition to that, we have space that we give back to the community. You can come and host your meetings, you know, free of charge. We really want to work with the community. That's our goal. All right? Please call us, 1-800. Oh, by the way, Carmen is our community liaison. Many of you may know Carmen. She's out there. She's always doing a great job. So I just wanted to give Carmen a quick shout out. What's the phone number, Carmen?
I just want to say real quick, good morning, everyone, and Madam Deputy. Again, I'm Carmen Cruzley, and I am the community liaison for the Bronx. Many of you have seen me throughout the community board district meetings. Many of you have seen me at senior centers, senior housing. I'm responsible for presenting our long-term home care, our HIV/AIDS home care program to our community at large in the Bronx. It is a pleasure, Madam Deputy, to have us to present our program, especially the long-term program, but really in particular our HIV/AIDS home care division. Our seniors in particular, as I want to stress, our seniors are really being infected by HIV. This is an epidemic not only in our young people, but in our older population as well. And I have a passion for seniors. I have a passion for seniors. We want to get the information out there on education, protection. We talk about sex in seniors, and that is one of the hottest topics. When I go to the senior centers and we talk about sex in seniors, I have their attention 150%. So we are asking, part of Beth Abraham, we are asking for you as community board district leaders, in the political arena as well, if you would like for us to come in and present at your district meetings, if you'd like for us to present at your senior centers, in your senior housing facilities, we are more than welcome to come in and present. I am your community liaison. It is our pleasure to be here today. I can be reached directly for referrals for the Bronx. Is 718-944-2265. My information is in the packet that you have today. And I just want to thank Madam Deputy for having us here today. It was our pleasure. Thank you.
Thank you. Thank you. I have one question before you leave, and that is, if someone wants to work as a personal care assistant or a home health aide, they've already been trained and have the experience, what do they do? How do they get?
They will go to our license agency, Best Choice. That's the name of the license agency. And the name of the vice president is Patty King. Patty King. Now, the number.
Yes. The information for Best Choice, they are located at 2275 Olinville Avenue, lower level. The main number is 718-944-2255, and they'll give you all the information regarding training, and if you're already certified, how you can then obtain a position within Beth Abraham.
Okay. Thank you so much.
Okay.
Thank you for all the information you provided. She said lower level, right? Our next group will be Paul Elston from Friends of Hudson River Greenway in the Bronx, and Yale Levy from the Riverdale River Fest coordinator to tell us about Riverdale River Fest 2010. And welcome this morning.
Thank you so much for having us. It's a pleasure to be here. And as you said, my name is Paul Elston, and I'm president of the Friends of the Hudson River Greenway. And Yael Levy on my left here from Community Board 8. So can we take that? I'm afraid I need to ask you to move in order to do this projector. We had to wrestle a little bit this morning to be able to get this presentation before you, and this is a subject that lends itself nicely to a pictorial presentation. What we're talking about here this morning is, first of all, the Hudson River Greenway. And that's a state-sponsored program with the idea of having a green place to walk and ride bikes along the Hudson River, connecting Albany to the southern tip of Manhattan. We'll be focusing in on what we call the link, the Hudson River Greenway link, which we hope will link the northern tip of Manhattan with downtown Yonkers, because there's no greenway connection between those two areas now. And of course, all of that focuses on people that are traveling either by foot or bike going north or south. But we're equally interested in the question of access to the river for our local Bronx residents and people that'll be going east and west. So you'll see that we're focusing on both. I'm going to give you an overview of where we are on the planning process for this greenway along the Hudson River. And then Yael is going to talk to you about a very fun event that will take place on June 19th, and we hope, 13th, and we hope you will all join us. The efforts here for the Greenway Link began in around 1998. And it was a small grant that we received from the state agency that was set up to promote this greenway. Basically, it was a group of local community members in Community Board 8 that looked at what the choices were for creating a greenway along the Hudson River. And we looked at 5 different routes, one along the waterfront, one along Palisades Avenue. Let me just get my pointer out here, if I have it somewhere. Yeah. Okay. Yeah. So Palisades Avenue is this route here that runs through the Special Natural Area District. The third one was a route that ran along the highway right here, and it's the access roads on the highway. A fourth route ran along Broadway here, and then a fifth route is the Putnam line that runs out here. And so we studied these and tried to figure out what we thought made sense. And what we found was certainly the most advantageous route, the one that would connect people with the Hudson River, was the one that went along the waterfront. And I guess the main conclusion that we came to there was, yes, there is room. In fact, there's plenty of room out on that waterfront for both the railroad, which of course has been there since about 1855, and our Greenway link. This was the sort of a typical cross-section of what we're looking at. On the very top is meant to represent the existing conditions, and then down below what we're proposing be done to the waterfront. If you count the number of tracks on the top, you'll see that there are 5 sets of tracks. And if you count the number of tracks below, you'll see there's 4. And the reason is that that 5th track, logically enough, it's known as track 6, and it's the one that's closest to the water. This one right here is not electrified. It's used about once a week to bring some cars to a sugar factory and film factory in Yonkers. And I'll come back to that and explain why we think it can be taken up. But we would take that track up, this track here, and we'd have the 4 tracks that are electrified and carry the trains. And then we think, although the width of this space between the tracks and the water varies as we go along it, we think there's plenty of room for a bike trail and a walking trail, and at the wider places, a place to sit and enjoy the waterfront. The second trail that we thought made sense is Palisades Avenue, the one that's closest to the river and runs along Riverdale Park. And again, while there was some concern, obviously by the people that live right there, we think there's plenty of room and rather easy access to create a greenway link along Palisades Avenue, and I'll show you more about that later. The long and short of it is that at the end of that study, the community in the Bronx was nervous enough about the idea of opening up this waterfront. The problem there would be teenagers partying out on the waterfront, some of which exists now. And the result of the considerations was an experiment. And this is the experiment here. This is a park that is called Riverside Park, and it exists at Riverdale Station. It's west of the station. And I can only say to you now that it's been 10 years since this has been in existence, and it has not created problems for the local community. And I think that while there was a lot of concern back in 1999, there seems to be much less of that. We do think it's important that anything that takes place out there must be secure and safe, but we think that the experience that we had so far suggests that that's very possible. And in fact, by bringing people to the waterfront, it probably makes it more secure and safe. That original study was for $50,000. In about 2005, Senator Schumer provided $1 million in federal transportation funds to do a obviously much more intense study of the possibility and more detailed study of the Greenway Link. It took about 3 years for the money to get down from the federal government to the state and down to the New York Metropolitan Transportation Council. You probably deal with them regularly because they have to approve all federal spending. They're sort of the main planners for transportation, particularly in this case because it's multi-jurisdictional. It's New York City as well as Yonkers involved, and a gentleman by the name of Howie Mann is responsible for directing the study. Now, this started in 2008. And the status right now is that we're focusing on Task 6 and the report from Task 6. On the left here is the front page of that report. These are the consultants that were hired by NMTIC to do the work. Task 6 is supposed to provide the body of information that would lay the foundations for 7 and 8. In 7, we select the routes that get more detailed workup by the consultants. And in 8, we actually do the detailed workup. And the schedule right now is that this study effort will end about 6 months from now. As you'll see at the end, we're not satisfied that Task 6 has been completed, and we'll be urging NMTIC to do more work before they declare task. We don't think they've created an adequate information base for doing Tasks 7 and 8. That is the selection of which routes are going to get the detailed study and the detailed study itself. Not too surprisingly, although we spent a lot of money on this, the routes that were studied by the consultant here are roughly the same routes that we studied back in 1999. A river route, the Palisades route, the route along the highway, and then the Broadway route. Now, the Putnam line, although everyone loves it and supports it, was not included because it's not part of the Hudson River. That's part of the Tibbetts Brook water shed, not part of the Hudson River watershed. And I think everybody that's been involved in this for some time now agrees that if there's any way of doing it, the most advantageous route that we're going to get is one that runs right along the water, and because obviously you're connected with it directly. And the second most attractive one is the one through the Special Natural Area District along the park there and then out to Riverdale Avenue. that provides a few points where you can get visual connection to the water, and there may be some opportunities for not just visual but also physical connections to the water. This is the Yonkers end of the study area. And, of course, Westchester has done a good job with its greenway, and it's not very difficult to take this through the Yonkers because they've developed that waterfront nicely. Very significantly, I think that the consultants recommended, and we agree with them, that they should tie into the old Croton Aqueduct Trail in terms of what the north end of this so-called link is going to be. Now, this is a map that the Friends of the Hudson River Greenway put together, and I just want to, I guess, dwell on one particular issue in just a second. But first of all, the three big issues that you have if you're going to try to do a water route, one is, how do you get across the Harlem River? If you don't get across the Harlem River, you're not going to go on any route in terms of going north. And that's a tough one, I got to tell you. The second area is how much land is actually available west, that is the water side of the electrified tracks. Is it adequate to provide for a bike and a walking trail and some areas to sit? And then third, what are the east-west connections? How do we connect this waterfront not just to people that are going north and south, but people that actually live in our Community Board 8, and everyone that lives beyond them? So we focused a lot on how do you connect from Broadway up to the waterfront, and then how do you get across the tracks themselves, which is the main impediment and the thing that's kept people away from the water for 150 years. That's what we're talking about here, 150 years. The one additional point I want to make here, over here, this is about a 4-mile stretch of the waterfront. Probably the total is about 5 miles before we're done. But this blue line, I think it's blue right here, represents the length of what I referred to earlier as track 6. That's the track that's used maybe once or twice a week. It's not electrified, it's old, and it's not in good condition, and it's the one that we think should be removed. And the reason that we think it can be removed is that there are two places. Now, about once a week, really, there's a separate engine that brings 6 cars down from the Croton Harmon yards. And these are freight cars. And they bring them down, and they bring them to either one of two locations. One is right here, which is, there's the switch that allows you to go over onto track 6. And the second is right here at the Bronx-Yonkers border. And we think that you can remove this stretch of track 6, which would provide ample room for the Greenway link across the Hudson, and then serve the two factories. There's a sugar factory there and a film factory, by simply switching at this location. And while we've been in long dialogue with Metro North on this, they have not agreed to that. And that's really going to be a central point, I think, as we go forward. So I'm just going to show you now some of our considerations as in terms of getting across the Hudson. That's a shot of the Henry Hudson Bridge. I don't know if you can see it, but it's beautiful. I'm telling you, if you could see a good shot of it. A second shot, both of those are taken from the railroad tracks themselves. And this is a shot from the Henry Hudson Bridge looking at what is called the Spuyten-Duyvil Bridge, which is obviously right on the water's edge there. It's a swing bridge that allows an Amtrak train to go across when it's necessary. This also provides spectacular views of the George Washington Bridge. There's a landmark Charlotte Bronte housing right there that also is visible from the link that we envision. So this is the route that's being studied by the consultant to take us across the Henry Hudson Bridge. And you come across Inwood Park. You've got to cross the tracks there, so there's a bridge, and there's no way to take your bike except to carry it on your back as you go up a fairly, I'm guessing, it's going to be a 30-foot bridge, 30 feet high, maybe 25 feet. and then you go up a hill up to the Henry Hudson, and then you got to figure out how to. You can cross on the lower level, but as it stands right now, that's been under construction for the last 3 years, and we've only had 2 or 3 lanes available to us. Eventually, it'll be 4, and we think that part of that additional lane is unnecessary for the cars and can be used for the bikes. That's the Henry Hudson Bridge I was just talking about. So this is Inwood Park as you're coming up from the south. This is going up the trail to the Henry Hudson Bridge, and this shot, if you can see it, gives you a sense of what the hill looks like. So you've got to be fairly hardy to get across this bridge. This trail now is the one that would take you along the Inwood Park, but right over here, connect you with the Spite and Dival Swing Bridge. This is the Spite and Dival Spring Bridge. This means that you can stay on the water, ride your bike along the water, not go up the Henry Hudson Bridge, even though there are spectacular views from it, but go across this. Well, this is a bridge that used to have 2 tracks running across it and now has 1. It's built for 2. And the question is, why can we not make that a bike trail right there? It would mean that when the bridge is open, obviously you couldn't take your bike across. You just have to sit and wait while boats go through. But that, I forget the number now, but it's not that many that actually go through there. But under Coast Guard regulation, you've got to be. This is manned 24 hours, and it's got to be open for boats when they want to go through. Now I'm just going to focus on this area after you get across that bridge. This is right after you get across the bridge. I don't know, can you see it all right? On the left-hand side there, one of the things that you'll find is at least 2, maybe 3 generations of old electrical equipment that the railroad has just left behind as they moved on to other types of technologies. And, of course, I suspect that there's toxic material in that as well. I don't know whether you can see this all right. This is a bridge right after that level. But this is the space that we're talking about, for this whole space here for creating a greenway link. This is the beginning of Track 6. There's that bridge behind, but this is the beginning of Track 6, which makes this area more narrow as you go. But even still, there's plenty of room with or without Track 6 on the west side of this for a greenway as you travel between the Spite and Dival Bridge and the Riverdale Railroad Station. Another shot of the same. This one is looking south. This is now these are the towers that you saw a second ago, and this is what's on the other side of the towers. This is the riprap that is the edge of the water. And, you know, we sort of think the worst case is that if it's too narrow in some places, we may be building on top of that riprap in order to do the greenway link. This is as you approach Riverdale Station. This is one of the tightest places that we see along the whole route. This is the park that I mentioned to you before, Riverside Park. This is the end of it as you go facing north at the end of the station. One of the things, this is now Track 6 over here. These are the 4 electrified rails here. So the consultant is saying, look, there's no reason you can't take these old tracks if you're going to leave them there and move them over to here and provide plenty of room for a greenway link there. Of course, we think the better solution is to take them up entirely, and because of what I said before, and that is that you can move over right at the Yonkers border to serve those facilities. This is a shot of the bridge that is at Mount St. Vincent, crossing the tracks, and again, Track 6 is right there, so way on the outside. Now we're in Yonkers. This is the Yonkers sewage treatment plant. The route comes right along the inside of the plant, goes into an industrial area. It could go across the Ludlow Bridge, or it could follow this area, which brings you to, this is a spectacular active sugar factory that is, you know, it's an active port, basically. The sugar comes in by, mostly by boat. There's some other chemicals that come in by the rail. And I think most of the sugar leaves by truck, but the path would come right around that, and we see that sort of as something to be preserved, protected, and we see it as a landmark itself, you know, an industrial landmark. It's a very important facility. down through the well-established now Yonkers waterfront, on past the BZAC Environmental Education Center, and then connecting with the Old Croton Aqueduct Trail at Trevor Park. On the east-west connections, we've specified 3 different locations that that ought to be considered for additional areas to cross the railroad tracks, and additional to what exists right now. One is at 232nd Street, and we see that as a connection all the way over to Broadway. One at Dodge, what's known as Dodge Dock, 247th Street. And then we think it would be very salutary to have another crossover at the north end of the Riverdale station, so that, I mean, it literally takes 10 minutes to walk from the north end of the Riverdale parking station to get around to the west, the New York platform. So I can tell you that it would be very helpful to commuters as well as to folks that want to use the Greenway. We think that the railroads are responsible under the 1855 land grants that were given by the federal government, are responsible for maintaining that access. And we've asked the consultants to look at this question, but it's not yet been done. Just to wrap up here, and then I'm going to turn to Yael for the fun part of this story. But we think the report, which is designed to really set us up for a more detailed study, is not yet complete, this Task 6. They have not provided adequate information on the Henry Hudson Bridge or on the amount of space west of the tracks, and they have not adequately studied the east-west connection, so we'll be pressing NIMTEC to continue that. Now, we gave this presentation in November, and NIMTEC came up and participated in it, and Yael and I met after that, because she has brought together a large number of people in our community to get behind this effort, and this is known as Riverdale Riverfest, and with that, I'm going to turn it over to her.
Okay, thank you so much, Paul. My name is Yael Levy, and I'm a member of Community Board 8. I'm on the Parks and Traffic and Transportation Committees of the Community Board. I'm also a Bronx resident, and I also work in the Bronx. I work right across the street at the courthouse. I'm an attorney, and I also have 3 elementary school-aged children, so I'm very interested in waterfront access in our community. I'm also an avid cyclist, and I commute to work by bicycle very often. So let me tell you how I got involved in this effort. I attended, in my capacity as a Community Board 8 member, this meeting at Wave Hill that took place in November, where the New York Metropolitan Transportation Council presented its design plan for the proposed Bronx Greenway link that Paul just told you about. At this, sorry?
You want me to turn this off?
Oh, okay.
Can we block that?
Yeah. And by the way, I apologize that I don't have a multimedia presentation. I actually intended to display our website over there, but I learned that we have no internet access in this room. So I was hoping to walk you through the festival website, but unfortunately I can't do that. So anyway, I attended this meeting. I got very excited about the prospect of a greenway in our community in the Bronx. And then somebody asked the question, is there funding to actually make this happen? And the answer was no, there's no identified funding source. And beyond that, I also learned later on that there are so many logistical considerations that have to be overcome even before we can reach the funding considerations. So I came away from this meeting thinking, what can we do about this, we as members of the Bronx community, to show our elected officials and Metro North and the Port Authority and anybody else who is a player in this, that we care, that the community has an interest in making this greenway happen before my children are out of the house and while we're still around. So I approached Paul because he presented at the NIMTEC meeting, and I said, well, why don't we do a festival, kind of like the Clearwater Festival that takes place in Beacon every year, that will promote awareness of the Hudson River Greenway project, because I really don't think that very many residents of the Bronx are even aware that this is going on. and will also get people excited about the possibilities that waterfront access would afford Bronx residents. I think most people in the Bronx live in virtual oblivion of the fact that they are adjacent to the Hudson River. The Hudson River is one of our greatest natural resources in this great borough, and unfortunately, we have no access to it save for that sliver of a park that was built 10 years ago on the other side of the Metro North tracks. And it's not even easy access. You have to go up a flight of stairs, down a flight of stairs. You can't bring a kayak and take it off because there's no possibility of, there's no dock. And of course, you can't carry anything heavy over it. So, and it's a wonderful park, and it's as close as you can get to the river in our community. But it's time to put the river back in Riverdale. And it's ironic, I would add, that the community in the Bronx that abuts the river is Riverdale, and yet we just can't put our feet in the river. So we need to do something about it, especially this year, which marks the 401st year of Henry Hudson's exploration of the river. And there have been a lot of projects going on throughout the Bronx and throughout the Hudson Valley to commemorate this historic moment. And so it's time for us to do something in the Bronx. So we have proposed in Community Board 8 to create a festival to welcome the entire community to the banks of the Hudson River. And with the generosity of the College of Mount St. Vincent, who has opened up their campus to us for this festival, we're going to make it happen. The festival, and I'm going to pass out posters, and I'll just hold up one of them. Ooh, just ripped one. Sorry, but this is, I'm giving these out so that, with the hope that you'll display them in your district offices. The festival is taking place on Sunday, June 13th, from 1 to 5 p.m. We took pains to make sure that it did not conflict with anybody's religious observance. It's taking place on the campus of the College of Mount St. Vincent on a very large 24,000 square foot soccer field that directly overlooks the Hudson River and the New Jersey Palisades. And even better, as Paul illustrated in one of his photos, there's a bridge that connects the campus of the College of Mount St. Vincent to the west side of the Metro North tracks, and there's a 2-acre plot directly abutting the river that's known as St. Vincent's Point, and the college is graciously opening up this bridge to us and allowing us to use this 2-acre plot of land for part of our festival. So we are going to get people right to the water's edge, really next to the water for this festival. Some of the highlights of the festival are we will have a presentation by the New York Metropolitan Transportation Council on its design plan. That's a given. But in addition, we will have we have about 30 at this point, exhibits and activities that will appeal to people of all ages, many of them focused on the river. We have Riverkeeper coming. We have an Enviromediamobile, which is a maritime museum on wheels that's coming to the festival. The Metropolitan Water Alliance, which does City of Water Day on Governor's Island, will have an exhibit at the festival. We have Lloyd Oldham, our official Bronx historian, coming, and he will be giving a lecture on the history of the Hudson River at the festival. We have Barry Keegan, who's a specialist in Hudson Valley Native American crafts. He will be at the festival doing demonstrations of Native American craft projects of the Hudson Valley. The Bezak Environmental Center in Yonkers, which is right on the river, will be coming with an exhibit of their own. And so on. I could go on. I mean, what I urge you to do is to view our website, which has the complete listing of each and every one of our activities and exhibits with links to those organizations' websites. But the highlight of this festival, saving the best for last, is that we have recently secured the Mystic Whaler schooner to come and dock on a floating dock that we are providing, and it will provide members of the public an opportunity to board the schooner. They can tour the deck, and some people, those lucky early birds and volunteers, also those who volunteer at the festival, will be able to go aboard the schooner for public sales. And so I might add that I haven't researched this question, but I believe that this may be the very first time that Bronx residents will be able to board a tall sailing ship directly in the Hudson River, directly from their own shore. And I think that's very exciting and historic. We will also have the John J. Harvey Fireboat come to the festival and display, it'll be squirting water out. So I think that's very exciting. The kids will love that. And we expect to have a kayak club come and kayak offshore also, because we want to show people what possibilities waterfront access would provide our community. Just imagine if we had our own dock here in the Bronx, if we didn't have to go down to Inwood or up to Yonkers, and we could put our kayaks in off our very own shoreline. So we want people to see all the possibilities. We'll have transportation alternatives come, and they're going to be talking about safe cycling at the festival. We're having a bicycle club come ride to the festival. We just want every possibility to be out there for members of our community so they can get excited about the possibility of waterfront access. So as I said, I encourage you to view the website to see the full array of activities and exhibits. I should also mention that we have a whole lineup of local musicians coming, and they are displayed on our website. They're all Bronx musicians. Everybody is local talent, and we will have food. We will also have a farmer's market at the festival. So there's something for everybody. We will also have a shuttle bus to shuttle those who are disabled from the parking lot at the top of the campus down to the festival grounds, because it's a bit of a walk. Although we encourage people to walk and ride their bicycles to the festival, we will have bicycle parking available. This festival is being organized entirely by volunteers who are working tirelessly, and all of whom are very passionate about waterfront access in our community. It's not being organized by an organization. All of us, we all have day jobs. We're all taking time out from our very, very busy lives and families to make this happen because we care so much about this issue. And along those lines, I should add that it's being financed. Although all these musicians and all the exhibitors are donating their time and talents, we do have operating expenses. And although the college is donating its grounds, there are operating expenses that we do need to raise money for, and we have raised a great deal of money, and we've raised it mostly from local Bronx businesses and residents. People, even in these difficult economic times, have donated very generously their time and money. So I want to urge all of you sitting around this table to please look at our website's homepage, because there's a click here to donate button and a click here to volunteer button. And please urge all of your constituents to go on the website and to make a donation if they can. No amount is too small. We have had a $5 donation. We'll take it. It's okay. It just shows that we have broad-based community support for this venture. Also to volunteer, although we have 2 weeks left before the event, we still have plenty of opportunities for volunteerism. If it's a middle school or a high school whose students need community service credit, we will write a letter. We will do whatever is necessary to make that happen. We actually have some middle school students who are going to come. I think we have a 4-H club that's coming to volunteer. So we welcome people of all ages. We have jobs for everybody. I also want to mention, along the lines of broad-based community support, and you can see this on our poster, that we have 40 nonprofit community-based organizations that have endorsed this event and are helping us to promote it. They range from religious institutions to schools to environmental organizations, to community centers, you name it. We have it all. We have a whole bunch of elected officials who support it, including our own Borough President Ruben Diaz and Councilman Capel. I'm sure if we had had the time to reach out to more of you, we would have gotten your endorsements as well. But as I said, we're only a bunch of volunteers, so we can only do so much. But this is a community-organized event. So I'm really hoping that we get a large turnout. I want you to help us in the next 2 weeks to promote this event among all of your constituents, because a large turnout will create momentum for this greenway and will speed the process to make it happen. And I really thank you for the opportunity to share my enthusiasm about both the Greenway and Riverfest with all of you, and I'm very happy to take any questions.
Thank you, Yael. You are so passionate about this, and it's wonderful. It's wonderful to see that we can have events like this here in Bronx County, and it's really a part of what we have been striving to do, to change the whole perspective of what the Bronx is all about. And certainly this is a great event, and we look forward to it being a great success. And we want to thank both of you for the presentation, and we'll be watching. If there's something more that we need to do, please let us know. But at least everybody in the Bronx gets a chance to know what you're doing, and also to appreciate what your efforts are in creating the Greenway link. Thank you so much.
Thank you.
Okay, thank you again. Oh, Arlene, I'm sorry, you had a question.
Not a question, but I'm Arlene McLaren with Councilman Oliver Coppell's office. We've been involved with this event for quite some time, and I just wanted to go on record as saying that we support you, and if there's anything that we can do to continue to ensure the success of this event, we're more than happy to do it.
Thank you.
Okay, in Cleveland?
Just one quick question. Has NIMTEC provided you with an estimate in terms of from design to construction, the proposed costs of this project?
Not yet. There are some cost items identified as we go through. Some of the big ones are missing. And so this 7 is to select the final routes that we're going to study in detail, and task 8 will produce that. So we're not quite there yet.
Okay, yes.
Two questions actually. You mentioned track 6 that there's traffic on there only once a week and possibly moving it over. It's non-electrified. My question is with respect to tracks 5, 4, 3, 2, 1. I'm assuming they're electrified. What action is going to be taken to prevent someone from going on to those electrified tracks, if you know?
Yeah, no, this would mandatory fence separation per Metro North specifications.
Okay,
so that'll be. I think you've got to think about that safety issue, but also just. I mean, we'll have a. If this is going to work, there's going to have to be a strong security system out there, so that there's no shenanigans going on.
Excellent. And secondly, you mentioned that there might be toxic material along the edge that was left over by the railroad. What, if any, type of remediation do you anticipate taking place with that?
I think it would be full remediation. I think the problem is right now, because people don't go out there, that the railroad is just free to leave it there, and that's the problem. If we claim this as a park, it's going to force that cleanup to take place. And it's a very important dimension of reclaiming this land for the people of the Bronx as well as New York.
Right. And lastly, for Yael, question with respect to the parking. Will there be parking, for example, I don't have a bike yet, but if I want to attend, where will it be located?
Okay, so, and this is actually displayed on our website. This is why I'm so sorry I couldn't go walk you through the website. But the college is providing us with a parking lot that is right at the top of the campus when you enter from Riverdale Avenue. It accommodates 160 vehicles, and some of those spaces will be taken up by some of our vendors. So I imagine that they'll fill up pretty quickly. We will have a shuttle bus shuttling those who can't walk from the top of the campus where that parking lot is located all the way down to the water's edge where the festival is located. Thanks to the generosity of Execuvan, they have donated the shuttle bus to our festival. As far as Accessoride, for those disabled people who rely on Accessoride, the campus is allowing Accessoride to enter the grounds and to come all the way to the bottom of the campus where the festival is taking place.
Thank you. Good. That's great. Very
we
good.
have more posters if anyone wants any.
Yes.
Okay. Thank you so much for your presentation. We have one final presenter, and that's Chris. You're Chris, right? Yes. Chris Kirker from the Census Bureau, and he's going to give us an update on the 2010 census. And I asked them to come at very short notice, but we asked them to come because we need to really get the message out to our constituents about filling out the census and accepting the census workers. Please.
Good morning, everybody.
Good morning.
Madam Deputy Borough President, it's good to be back here. I proudly can say I used to be a former Bronx liaison for the Borough President's office. And for the past, I should say, 1 year and a half, I'm working with the U.S. Census Bureau. As you might know, the census, because often people ask, is census ended yet? No, we're still going. Actually, it's going to go until end of July. At this time, we enter the third phase of the census. As you might know, it started in 2008, which was the awareness phase, where we let everybody know about it. You know, they should be aware of it, that the census is coming around. Excuse me. There was motivational phase, which we already have passed it. It was as of May 1st, where we motivated everybody to get involved. And now it's cooperation phase. Then the fourth one is going to be the thank you phase, that, we're going to contact all the partners that help U.S. Census, where we can give them, a praise about the job they have done with us. At this time, as I mentioned, it's a cooperation phase. What it means, at this time, we have what we call the enumerators or door knockers going in each resident for the people that haven't responded or they responded too late. What it means by responding too late? Well, for us, the due date was April 1st, even though it was extended until April 15th. So whoever has received the mail for a reason of apathy have sent it back past the April 15th. Even though we received it, yet again, the enumerator is going to go and knock on the doors. The good thing about our team here in the Bronx, I can say, is that the Bronx in 2000, the response rate, emphasizing response rate, was 57%. At this time, the response rate, we raised it up to 62%. Some people might say it was just, 5%, what it's going to do. Translating those 5% in money, I'm going to say in 1%, it's equal to $89 million nationwide that we have saved, because you got to understand, all these people are going to go and do door knocking. It cost us, I should say, triple, quadruple more than for us when we sent the mail. It was kind of confusing in the beginning because people say, well, we got about 4 or 5 times the forms to fill it up. Well, it was good to fill it up just in the first time, but to make sure we still send it more. I was listening to my previous speakers here. They're talking about planning this and doing that. Well, everything translates in money. Without having that, nothing can happen. Everything's going to stay in the paper or probably projected in the wall, and that's about it. So the best way how to do it, get a correct count. We get a correct count of this county, we can get federal money. We're talking about $400 billion every year that is trickled from federal down to small agencies, small organizations, and so on and so forth. So at this time, we're urging, especially elected officials, I met with most of them. I met with Jeff. I've been at Dinowitz's office. I've met with them, with Ms. Foster. With the Borough President, he's been spearheading a lot of activities when it comes to the census. We've done presentations to many community boards. We're going to come again. Probably this is the last month, based on my knowledge, my experience, probably, that you guys are going to meet, because July, to my understanding, the board meeting is mostly about, thanking everybody, and August is closed. So we're going to try to do another presentation, just a reminder that please try to spread the word out there to have people to cooperate, because as of lately, we have heard different kind of stories. The latest one that we heard about it was for the 2219, which is located in Throgs Neck area. People were chased with broomsticks out of their houses, which is ridiculous. And also, what we're trying to do, at least me, I'm also a partnership specialist for the Albanian community. I've given an interview on the local TV, explaining to them in Albanian language, I should say, about explaining that the people that's going to show up over there on the door, they're not allowed to come in your house, even though they want to be welcoming. So they cannot come inside the house. They're just going to be by the door, take your information. All of them is going to have badges that's going to look like this, or probably without the picture. And they're going to have the bags that have the U.S. Census Bureau logo on it. So other than that, if people start bothering you, and especially if they ask questions more than just the 10 questions that were in the form, which basically the most intimate question in that questionnaire was the telephone number. If they ask for more than that, then you shouldn't give it. And right away call 911, because it's going to be a lot of impersonators in that time. So, in conclusion, what we're trying to do at this time is just really urging the general population, the constituents, to really open the doors. Because even though that we're going to come knock on the door almost about 6 times, yet again, what we're trying to do during this period of time, because each time they go out, it costs money for the taxpayers. We just leave a form, or we leave just a notification on the door, so a telephone number is given so you can call that number, and people can do that over the phone, because often I've been asked, if it happens that I'm a person, I'm just, working hard, because in these times, like the gentleman mentioned before me, hard economic times, people work like 2 jobs, come in the morning, just a quick sleep, and just go back out there. So we don't blame them, and that's why we leave a form and a telephone number in which it says that you can call this number, and somebody's going to be asking the question when it comes to that matter. Thank you, everyone. Appreciate it for having us. Yes, ma'am.
I was in Co-op City last week with Marisol, and I'm glad you're here, Cleveland, because we got a number of complaints from the residents of Co-op City. There is a great fear about people opening their doors just to even look to see if the badge is legitimate.
Okay.
They don't want to open their doors. They will not open their doors, and they made it very clear to us because they are fearful. And they wanted to know if there was some way that the Census Bureau could notify them when they are coming and who is coming so that they would know who to expect. Is there some plan in place to deal with issues like that, especially with such a very large complex?
Well, as I mentioned before, once the person comes, the door knocker, and doesn't find anybody that can open the door over 18, of course, to take all the information in the house, they just leave a little paper with all, with the insignia of U.S. Census Bureau and telephone number that they can call, and they can be given all that information over the phone. That will be the best way, since people don't agree to open the doors. And when it comes to the matter about, letting them know around what times, well, we have people that can't go in the morning, people go in the afternoon. I mean, particularly around what time they can be, it's going to be kind of tough to kind of nail it and say, like, for example, this person's going to come. If we have a window opportunity, maybe. But when it comes to that, they usually have a form that they just put it on the door, and they can call that number, and they can give all the information over the phone.
And I also understand that you're planning to set up tables.
We're going to set up tables, exactly, in Co-op City. Mm-hmm. Actually, me and my team leader, Rafaela Santos, and a bunch of us colleagues of the Bronx, that's what we're willing to do. We're going to set up tables. At least we're probably going to give a notification ahead of time, letting people know that, listen, by the way, we're going to be here. So if any information, or if you see somebody coming knocking on the door and you're kind of afraid, this is the number, we're going to be in this place, we can tell you, yeah, well, the person knocking the door, it's a numerator.
Mm-hmm. Jeff?
Sure.
I know in our district, the census did an excellent job. I know Annabelle wanted to thank the Census Bureau for reaching out to the Parkchester management office and actually getting permission from the management office. So I don't know if you know off the top of your head, but are there any other complexes like that where the cooperation hasn't been there from the management office besides Co-op City? Are there any other complexes in the Bronx where you haven't been able to get that kind of permission and that access that you needed?
Well, based on my experience, when it comes to the census, everybody's been very cooperative, and not only that, but you got to understand, we, this year, at least, I haven't done any other census before, but I was told by colleagues that, they had previous experiences. They have been very satisfied with whatever the response when it comes to management, elected officials, heads and leader of organizations. They have been very cooperative. My personal experience when I was at a Riverside Park, the management over there, they were wonderful. They allowed us to go, even because we did what's called a door hanging, because we have those door hangers. I don't know if you guys have seen them. Mm-hmm. We blast the Bronx with it. Personally, I've gone with my assistants, and we'll take it block by block, going door to door, putting that. We're being sick by dogs. We're being chased by people, But we did it because we want to make everybody aware. And when it comes to that, management has been very cooperative, and all of them, organization leaders, everybody. So,
Cleveland?
Cleveland back at Councilman Seabrook's office. Number one, the Census Bureau has been a very good partner. When we had our Martin Luther King luncheon, we had a lot of people from the Census Bureau who came, and with the bags, and people were aware. What I would say is that, number one, in regards to Co-op City, I would think that we would be helpful in terms of working with River Bay Corporation. Well, it was not management, but as was indicated previously, that some of the residents are concerned, obviously, because of the time frame, and there's a tremendous crime issue.
Yes.
So if you would like, I think we would be willing to try to facilitate dialogue between the Census Bureau and the River Bay Corporation management to find out if there was, for example, a certain day which there was going to be like a blitz, for lack of a better term,
Right.
of Co-op City. That might be something that we could be helpful to work with. And we could also talk offline in terms of possibly working further with our office that we have in Co-op City. But at minimum, we would be willing to do that. And then secondly, one of the dynamics in Co-op City, especially since they're having their board elections, it's helpful to do some type of notification in the community newspaper there. And I'm sure that that's something that may not be, it probably would be free. We can speak with them as well, because that is something that is laid at every single, if not door, by every single elevator throughout the entire complex. And that would, residents read that. And then that might alleviate some of the fear component. Not completely, but somewhat.
Well, definitely I'll bring that to my superiors. But based on my experience, one of my colleagues, Linda, what's her last name? Linda Burke, Miss Linda Burke. She has been dealing with, because River Bay, she's been our partner since the beginning, since we started. And Miss Linda Burke also, she has spoken with them. We have done different operations, starting from, as I say, from blitzing the area when it comes to door hanging, to talking to the River Bay. It's been they have put a notification in the letter. I mean, they're monthly or weekly, I think, if I'm not wrong.
It's weekly.
Weekly paper. And also, I've made partners with the center, the Kids Bay Boys and Girls. I think it's Gloria Wise. I've made partners with them. I've spoken with the director over there. Whenever activities have happened, we've been there. On the times that I can record is that when also the borough president's office would do the National Night Out, the 45th precinct, we've been there present, so people have seen us in different occasions. But I'll agree 100%. Definitely, we can sit down together again. We can just tell them that, listen, just to make you aware that people are going to continue to come knocking on the door until they're going to get a response. Because for us, it's important for everybody. I mean,
Right. Okay, thank you so much.
Thank you, everybody.
And
Nice
thank you,
weekend.
everyone. We'll meet again next month.